statewide Slack group. There's a statewide Slack group, and there's some other organizations and meetings of independent facilitators. And most of the local advisory committees in self-determination, if you go to those meetings, oftentimes you'll at least see a couple independent facilitators from that area who are there. Okay, financial management services. Now, before I move on, I just wanted to check Q&A. So what we covered so far is we covered the importance of the circle of support. We talked about the structure of self-determination, right? The history, how it got started, the pilot project, this phase-in process, how the state worked with the feds to get federal approval. And then we just finished talking about independent facilitation, which is a new role in self-determination. So I want to pause and just take a look and see if we have anything in Q&A about any of those so far before we dive into financial management services and budget stuff.
It does not look like we have any questions, actually, Sheraden.
All right. So,
oops, one just popped up.
Okay, for circle of support, how do we, maybe there's more of the question coming. How do we find people? So the circle of support, you know, that's going to be friends, family members, professionals that already work with you or with your loved one. The people that maybe don't know everything, because particularly if you're a parent of a young child, nobody's the expert in your child like you are, right? But think about, do you have extended family, friends, neighbors, people that provide services to your kid that know parts of them and can come to the table, so to speak, in helpful ways in terms of helping with planning or with preferences, that kind of stuff. And then for an independent facilitator, that might be a new role that you bring on board. And actually, some people that I've talked with have said, you know what, I always had this family friend, or I had this person that I stayed in touch with who's a professional in XYZ. They already have been serving me and my family a lot like an independent facilitator. So when we transition to self-determination, I actually want to bring them on board, either paid or unpaid, whatever that agreement is. So for some people, they already have somebody that does some of those things that an independent facilitator would do in their life already, or in their child's life already. How does this tie into long-term planning for kids in schools? Yes, so remember, everything that we're talking about with self-determination is through the regional center system. That being said, of course, it's always helpful to make sure that there is some coordination with regional center and school district or healthcare insurance funded services. As your loved one gets close to transition age, especially once you get around 14 and 15 and 16, you definitely want that good coordination there. Transition time is a very exciting time. There's a lot of things that are happening or that should be happening. Definitely make sure that you are inviting people from your regional center circle to IEPs or to transition meetings around that time, okay? So that's very important, especially around transition for kids that are in high school, very critical. How do you find an independent facilitator? So I mentioned that some folks already have somebody that in their life or in their child's life that might be good for that role. Otherwise, if you come to local advisory committees, oftentimes you can meet some people that are independent facilitators. Many state council offices, regional offices like mine, have done training for independent facilitators. So sometimes you can call us and say, you know, hey, I'm looking for somebody in this county, in this area. You know, we don't endorse any specific independent facilitators, right? We don't endorse any particular services, but we can say, hey, we actually have some contact information for folks in your area that have specialties based on what you're saying. Also talk with your regional center. So your regional center may already be aware of or have an informal list of folks that are providing independent facilitation services that might meet your needs, because remember, one size doesn't fit all with independent facilitation. Also, in most areas of the state, there are groups, independent facilitator community of practices, or Slack groups, or collaboration groups, where there's multiple independent facilitators that are coming together to talk about creative ways to serve people, to expand their businesses. Okay, so those are a few different ways that people find independent facilitators. Let's see, Sarah says, it's been difficult to find a school aide, for example. We have a structure in place, but can't find people. Yeah, so for school aid, so anything that's specifically for education or that it's a part of you or your child's IEP, that has to be through school funding. So that has to be through the IEP process. So you can't use regional center funds, even in self-determination, to address things that your district should be providing for you and for your child. So, so this is not, self-determination is not going to solve your problems in the school district realm. However, after using existing services that are funded through your school district, that are recognized through your IEP, and using other generic services, let me give you an example. People that have IHSS, you still have to use your IHSS dollars. You can't say, forget about my IHSS dollars, I just want to use self-determination dollars. You have to still use your generic services or the services that are funded through other sources, school district, IEP, IHSS, your health insurance. But then you could choose to use some of your self-determination dollars on top of that for additional supports and services. Okay, so I hope that helps a little bit. I have some slides a little later on. I also see, is there a directory of independent facilitators? No, there are informal lists. So, so check, similar to what we talked about earlier, check with your regional center. They may have an informal list. Your local state council office may have an informal list. There are also community groups of practice. And at those local committee meetings, oftentimes independent facilitators will come and sit in on those meetings or introduce themselves at the beginning of the meeting. So those are a few different ways that you can get to know some independent facilitators. In some cases, people do multiple of those things that I just mentioned. Yeah.
Sheraden, also somewhat related to that, will there be some kind of a list for people to find people that are certified as person-centered planning facilitators?
Yeah, so here's some interesting stuff that's in development around person-centered planning. So because person-centered planning is important always, but it's important specifically when you're transitioning to self-determination, part of that is as you transition to self-determination, you can get, if you need, some person-centered planning dollars as a part of your self-determination budget. Specifically, the regional, there's a service code with the regional center called 024. And what that does is that's a way for you to work with your service coordinator or your case manager to find an eligible or qualified person-centered planner, and then to have some of that paid for, okay, to have some of the person-centered planning funded. So I'll show you a DDS directive that talks about bringing on and getting some funding for person-centered planning facilitation. Not everybody wants that or needs that, but it's an exciting component that can be offered and that can be funded in part by your regional center if you're entering self-determination. So a lot of regional centers in the state, what they have is they have a list of person-centered planners that they work with and that have demonstrated to the regional center that they have the extensive training and that they produce person-centered plans that are high quality. And so most regional centers do have a short list or courtesy vendor with other person-centered planners in different parts of the state to say, oh yeah, we would go ahead and pay for that person to help you with a person-centered plan if you're in self-determination. So that's really cool. But I want to be clear, that doesn't mean that that's the only option, right? So if you have a person-centered planner or plan facilitator in mind that you want to work with, and you're going into self-determination, you want to talk with your service coordinator and say, hey, I'm going to need some help with a person-centered plan. I have this plan facilitator. I want to connect you so I can see if they can get paid through service code 024 to do person-centered planning for me. So there may be, the regional center has to look more into that person, make sure they're qualified and that they produce plans that meet that regional center standard to pay for them. And if you're not using regional center funding and you just want to get help and do your own person-centered plan or bring in professionals, but not use some of that, some of the service code funding through the regional center. If you're in self-determination, you can do that. But if you're looking to get either reimbursed or looking for to have the person paid directly, you're going to have to either use somebody that the regional center already knows produces high quality plans, or you're going to have to connect them to have them go through. It's kind of like a mini vendorization specifically for person-centered planning. So I hope that's helpful. Okay. And again, that's for folks in self-determination specifically that are entering into the program. So I want to move forward because there's a lot of components of the FMS service, the financial management service, and the budget and the spending plan that I want to introduce you to, because these are a little bit more complicated. A lot of times people get a little bit stalled, and so I want to make sure that we have enough time to talk about these components. Oh, okay. Let me answer this last question here. Where does the independent facilitator get their training? So the very nature of self-determination is that it's not overly government regulated, okay? So there is no 1 approved or 2 approved trainings for independent facilitator, okay? Which is great, but then also a little bit harder, right, for some people because they just would love to go to one place and one-stop shop. But self-determination is not about one-stop shopping. It's about freedom. It's about freedom, creativity, and responsibility. So remember going back a few slides. Let me see if I can find that here. Here we go. Okay. So an independent facilitator, they have to have training, any kind of training, but sufficient training on self-determination. They have to have training on person-centered planning. And they have to know how to do what you want them to do, if that's finding certain types of services and supports. Okay, so they have to be able to say that they have that and provide evidence of that. As an example, some of the independent facilitator trainings that I or that my colleagues at the state council have held, you get like a certificate afterwards, or we have records of that. So you could call and say, hey, did so-and-so ever take an independent facilitator training with your office? They said that they did. And I can say, oh yes, winter of 2020, they did an 8-hour independent facilitator course with us. Now that's not me certifying them, right? Because remember, you can't be certified as an independent facilitator, but I can say, yes, they went through training, they were participating in training, they got all the foundational skills. Now, but there's going to be some independent facilitators that are way more skilled than others, and there's going to be some that are focused on very specific tasks and others that are more generalists. So there is no one certification. So there is some talk about creating some more formal lists of independent facilitators. But even if that comes out, just so you know, those lists don't equal like certification because the government's not certifying independent facilitators. But there is some talk about the benefit of having some, rather than informal lists, to having more formal lists of independent facilitators. Okay. All right, let's dive in to financial management services. Okay. So financial management services, or FMS, as I mentioned before, is the only required service that you need to be in self-determination. It's also the only provider that's required to be vendored. FMSs help you make sure that your workers are eligible to provide the services that you want to hire them to do. I talked about that earlier. It makes sure that if they're providing a service where they should have a background check, that they get that background check and have it on file. If they're required to have any licenses to do the type of work that you're hiring them to do, the FMS is going to verify that they have that up-to-date license or training. Your FMS gives you in the regional center a monthly report about how your spending is going, so that you know how much money you have spent and how much is left, and if you're on budget or not based on your spending plan. Your regional center or your independent facilitator can help you find an FMS provider to choose from. Of note, there is a list on the DDS website that has a list of all vendored FMSs across the state, in which ones are serving in which catchment area. Okay, so that's located on the DDS website. This is an important little part. So generally, there's a small monthly fee for that FMS service. Think of it as like your accountant, okay, for self-determination. There are 3 different programs of financial management services that you can choose based on how involved you want to be and what kind of people or what types of services that you're hiring or that you're paying for. So all of that would come out of your budget in a small monthly fee. And that monthly fee, there's a cap depending on the type of the 3 types of FMS that you're choosing. So that would normally come from your spending plan. However, there was a DDS directive that was put out in November 2020, and it's still in effect until early July 2021. Will it get extended? I don't know. I don't think so, but it might. And basically what that DDS directive says is that pursuant to Governor Newsom's proclamation of the state of emergency, basically because of everything that's been happening with COVID, that the cost of financial management services in self-determination that cost is being waived. So the person doesn't have to pay for that out of their budget. The department's been waiving that fee, has been covering that. So that's through, that directive has a date of early July. So that's great. So anybody that's been in self-determination from, I want to say that started, it was effective in October, even though the directive was in November, they haven't had to pay their monthly FMS fee, which is great, out of their budget. So that's kind of exciting. So who can be an FMS provider? It can be any provider or person except for a relative, legal guardian, or other legally responsible person who's chosen by the participant, and they have to be vendored as an FMS provider. So they have to go through all the qualifications and have all the training to go through vendorization as an FMS provider, okay? And those requirements can be found on the DDS website. So that is a regulated position, meaning they have to be vendored, they have to have the, all of the specific training. That's a very traditionally structured role. Okay. Also, the financial management services provider has to comply with all the requirements that are outlined in Title 17, specifically Section 54327 of Title 17. That includes reporting any special incidents reports, okay? So they have that responsibility to look out in terms of health and safety or any risk of financial abuse, physical abuse, sexual abuse, neglect. FMS helps keep important parts of somebody's self-determination in order and organized, helps the person make sure that their support staff and workers are eligible to provide those services that they want them to do. Those 3 models, remember I talked about 3 models. So the 3 models are called the bill pair model, the participant as a sole employer model, and the participant and the FMS as a co-employer model. So those are 3 different models, and the one that you check has to do with what you want to use them for, how involved or not involved, how many folks or contracts you think you'll have, or just a few. So that's all dependent. And if we have time, I'll show you kind of a comparison sheet of the different models of FMS and how you can choose which one might work best. That's also available on the DDS website. So the person's going to work with their circle of support to develop a solid understanding of which of those FMS models is going to be best for them. They're going to think about what level of responsibility they want to have with hiring and firing workers. They want to think about how many reminders or what types of reminders they might want to stay in their budget. How complex is their case going to be? Are they looking at purchasing a lot of things and hiring a lot of people, or not so many? So all of that will lead somebody to decide what makes the most sense, what type of model of the 3 service models of FMS work best for them. All right. And then, so let's say you have your IPP, you have your FMS, you're also thinking about what makes sense, or these are some questions that might be helpful for you to think about. when you're hiring an FMS provider. This goes in line with some of the questions that I talked about in the last slide. So do you need help with employees? Do you need them to pay bills and send statements to you? Do you need them to purchase items, actual items or special types of equipment? Do you want full responsibility for the people that you hire? What about taxes and liability? Do you want help with the business of having employees or independent contractors? All of that are some questions that will lead you to choose what kind of FMS is right for you. Okay, budget. All right, so I want to get into, let's see here. All right, I see a question here from Laura. Recently moved out to California. How can I make person-centered planning work for us? Have a son with Down syndrome who's 16. Oh my gosh, 16. So this is an exciting time because you're trying to get started with, get an IEP and a transition plan. Transition plan should definitely be happening now at age 16. Then I'm assuming that your child is with the regional center too. So you want to get started. You're trying to learn about the regional center that works very differently than in other states outside of California. There's a lot that you're doing now, both in terms of district services and the transition planning and regional center services. Definitely, Laura, I would recommend that you take a look at the recording of our session from 2 weeks ago on person-centered planning. That's going to help you. And that will be some things that help you both on the school district side and on the regional center side. So, I assume, Laura, that you're now set up with the regional center services. You can start thinking about the pros and cons, the differences of just traditional service models or trying self-determination here in California. Okay, individual budget, guys. I want to be clear. The step of creating the individual budget is separate from a spending plan. These are two separate things. I think a lot of people get stuck or get confused or have unnecessary conflict because they don't understand that an individual budget, developing that budget number, that happens before the spending plan. And those things are separate activities. All right. So the budget is just about getting that magic number. Okay. Getting the big number in general, the big broad categories. It's not developing a full spending plan yet. Okay. So individual budget. So the individual budget for self-determination participant, it's determined going through a few steps. So it's a multi-step process to get to your budget and to have that certified by the regional center. So you start with your baseline is the amount of services that were paid for in the regional center system in the last 12 months for you. Okay. So for our friend Laura here today, if you just moved to California, you don't have anything that the regional centers have spent on you and your family and on your son from the last 12 months. Don't worry, okay? But for any of you that have been with the regional center system, the number you're starting with, not ending with, but the number you're starting with for that multi-step process of a budget certification is how much did they spend in the last 12 months, okay? So if you don't have that sheet that they're supposed to be mailing you annually, you want to ask for that for your service coordinator. You want to ask for your total purchase of services from the last 12 months, okay? So you can see what that number is. That is your starting place. So that's your starting place, but let me give you an overview, okay? So the IPP team is working out, okay, what did we spend last year, right? What was your total purchase of services, your expenditure, not what was authorized, but what was spent this last 12 months. Or if you're new to the regional center, the starting number is what would we have expected to spend on you or your loved one based on what we spend on other people with similar needs and similar living situations. So for our friend Laura, who's new to California, they would say, all right, let's see, Laura's son is 16. He lives in the family home. He has Down syndrome. He goes to school. Okay, he's got healthcare. So they would say, all right, what would we have spent on somebody of Laura's son's age and where they live and the types of needs that he has? What would we have spent on somebody very similar to Laura's son? That's our baseline number. Okay, so you got your baseline number. Now there's extra steps. So you take that baseline number and then you're identifying, meaning you and your regional center, your circle of support are working together. What are the unmet needs? Okay, meaning what were the regional center funded services in my IPP that I didn't actually get? I didn't get because we didn't know it was available until it was, super late in the year, or there weren't any, I couldn't find anybody to serve in that capacity, or there weren't any providers that provided that, or whatever it is. So unmet needs, things that were not addressed, but should have been addressed or should have been paid for. Then the next step is change in circumstances. Okay, so were there any major life changes that affected my needs? So it could be that last year I was very sick and spent a lot of time in the hospital. So I wasn't able to use a lot of regional center funded services. I was mostly using insurance funded, durable medical equipment and medical expenses covered through insurance. And now I'm healthier. So I'm spending more time in my family home or in the community. I have other needs. I'm back in school, whatever that is. Or change in circumstances, meaning, hey, last year I was in school, this year I'm graduating. So I'm looking at a whole bunch of new and exciting things that I wouldn't have been eligible for last year, but I will be because of my change in lifestyle, my change in circumstance. Okay, then after that, what you're doing is you're identifying services and supports that were funded this last year that are either one-time or non-continuing based on the change in need. Some examples of that would be like if I am in self-determination and I got some initial person-centered planning services to help me transition to self-determination, that's a one-time cost. So I don't get that in my budget ongoing. Or if I had to purchase durable medical equipment with my regional center funding, or I had a home modification or an automobile modification last year, that's kind of a one-time deal. So that doesn't stay in my budget ongoing. That was kind of a one-time, non-continuing payment. Then I'm identifying the services and supports that were or are available, but will be funded outside of the self-determination calculation, outside of my self-determination budget. I'll give you some examples. If I got a job last year and the agency I worked with got competitive integrated employment incentive payments because they helped me find a job, that's kind of a separate item. So they can still get those payments if they're helping me with work. But that's not on my budget because it's kind of a special thing that's all by itself. Another example is if I am in the paid internship program. And so the regional center system is paying for paid internship payments to me for my internship. That's kind of separate, right? So that's not going to be in my calculation. That still gets paid for if I'm in my internship. I still get those payments, but that's not a part of the calculation for my budget for self-determination. Other examples would be any cost for insurance co-payments or SSI, SSP restoration payments. So all of those things are not a part of the self-determination budget, meaning it's kind of separate. So if I need it or it happens, but that's not part of my big budget number where I figure out my new spending plan for self-determination. And then we'll talk about this also in a little bit. There's so much to cover, but are there restrictions of what I can spend once I have a certified budget? Yes. Because you can still only purchase services and supports that are approved by the federal government for being home and community based, okay? And remember I mentioned earlier, if there is another funding source for that service, you have to use that funding source first, right? So if it's something that my school district should be paying for, something that health insurance or IHSS should be covering, I got to use that funding first before I start spending self-determination dollars on that thing, right? That should be doing. Okay, so part of that budget certification process is, okay, we have that magic number now, which might look very similar or very different from what was spent on me last year, right? Because we went through that whole calculation. So let's say we got that budget is certified, stamped and certified. Woo, okay. So now we transition to the spending plan. Okay, so the next step is to build a spending plan that shows how we're going to spend those funds. So one of the wonderful parts about self-determination is the streamlined spending categories. Okay, so these 3 categories are the major spending categories. There are many, many, many subcategories. Okay, and I'll show you, or can make sure that you get those handouts that list all of the subcategories. But it's important just to know about these 3 categories, because that means you're going to have more flexibility in how you spend within them. Okay, I'll talk about that. But because there's just the major 3 spending categories, there's more flexibility for the person to shift some of their funding if their needs change without having to go back and do a whole new IPP. All right. So those 3 categories, as you see here, are living arrangements, employment and community participation, and health and safety. Pretty broad, right? So there are parameters, of course, of what can be funded. So, you know, room and board and rent and food and utilities for the most part are not eligible. You can't use your budget on that. Individuals will not be able to pay for those with their individual budget, because the feds say, you can't use your regional center funded services for those things for the most part. And then remember the generic services part. So if there's something that has to be paid for with another funding source, you have to use that other funding source first. Okay, so let's go back to these budget categories. So I'm developing my spending plan. I already have my budget certified. What if I need to make changes in my spending plan during the year? So this is cool. Participants can make changes to your spending plan during the year pretty easily. Participants can transfer up to 10% of your funds originally distributed to the budget categories here. You can transition them from one budget category to another. So you can do that up to 10% of that original amount, which is pretty great, without having to go back to the drawing board, update the IPP, all that. So that gives you flexibility. You just have to let your FMS know, let your regional center know. Now, if during the year you need to transfer more than 10% of your original amount in any of those budget categories, if you have to move more than 10% around, then you're probably going to have to say, all right, regional center, all right, FMS, let's update my IPP because I'm moving more than 10% from one category to another. All right. In which case you would just have that IPP meeting, you know, and talk about those updates and get those documented. No big deal. But think of how wonderful it would be to be able to transition up to 10% from one category to the next without having to go through that whole IPP updating process, which is kind of nice. All right, service providers, right? So like who you're actually spending, you know, who and what you're spending your money on. So you know, of course, that you can get help from your family or your independent facilitator. You're communicating to a prospective employee or service provider about what you want and how you want it. You're maybe negotiating, or you're having your independent facilitator negotiate for you the terms of that contract. You might be talking to other self-determination participants, you know, so definitely you want to spend time with other participants, and maybe you're saying, hey, I see that you're hiring such and such or so-and-so. What's your contract look like? So maybe you're also getting ideas from other people in self-determination. There's a lot of great groups where people talk, families talk, or individuals talk. You can also ask your regional center about how much they pay for a similar service in the traditional model. So there's a lot of the different ways that you can think about how to decide what that contract would look like. And it's important to remember, you need to both think about what's important to me and what's important for me, the wants and the needs, when you're thinking about all the different ways that you would be spending your budget and self-determination. So these are a couple of questions in each category about what you want to think about when you're hiring providers or hiring people to provide services. Do you need somebody with a certain license or a certain medical background? Does the person you want to hire, do they know your language? Do they know your culture? Do you need somebody who drives? Do you need somebody to help you with personal care? You know, how are they going to make sure to keep your privacy respected? how do you expect them to operate when they're on the clock for you? So those are just a few examples. And so agreements, when you're creating agreements with your service providers, in some cases, your FMS can give you some helpful hints depending on the type of service or the type of person that you're hiring. Also, independent facilitators are great for this, helping you develop contracts or develop agreements. Your service coordinator or your caseworker could also give you some helpful understandings about what to think and what to include in any contracts. You want to be clear about the details, and then you want to make sure that your planning team has that. So the regional center has that and your FMS has that, and you can get help with that. But at the bare minimum, you want to make sure, what are the expectations of the job? What's the start date and end date? What's the rate of pay? Is it going to be hourly? Is it going to be monthly or weekly, or, based on a deliverable? Where is it going to take place? How are they going to communicate with you? How will you keep track of when they work? What are the hours and the days of the job? So those are just a few basics, but you may have one that looks much different depending on your needs. Okay, we're not going to go through this because you guys know this. You guys are pros. For those of you that have been with us in previous sessions, it all goes back to, you have to start with person-centered planning. Don't get started in self-determination if you haven't done some work in person-centered planning. Person-centered planning is going to help make sure that when you transition to self-determination, that it's successful, that you're thinking big, that you're thinking outside the box of traditional services. And make sure, of course, that, if you're a family advocate with a minor child who's the participant, make sure to keep them involved in all the ways that they can, with whatever communication styles work for them, with whatever engagement ways work. That looks different for everybody, of course. And remember that if you're in self-determination, you can get help using service code 024, which means that you can get some person-centered planning funding covered by the regional center, up to $2,500 even. It just has to be for somebody who can demonstrate to the regional center that their plans are of high quality. So either somebody that's already worked with the regional center, or somebody that can work with the regional center to do that mini vendorization for that. Not everybody's going to use that, but it's available for folks that are going into self-determination. That's pretty cool. Okay, so what I want to show you, I think pretty soon, I'm almost done with this deck. I want to show you the list of the subcodes, the sub-services underneath those major 3 buckets of spending categories. Important to remember that you have to try, as you know, other services, generic services first. And then remember, we've talked a little bit in previous sessions about inclusive community services, or services that provide the opportunity for people to be more included in their community, have the opportunity at least. Home and community-based settings, also known as the final rule. So the Centers for Medicare and Medicaid Services, that's the federal department, all states have to be in compliance very soon with HCBS, home and community-based settings, the final rule. So when you start hiring people or agencies for self-determination, part of that process is the regional center working with you to make sure that who you want to hire, the agency you want to hire, is going to give you choice and inclusion, options to be included, options to be in non-segregated environments and services. If you want to bring on a support or service that's very isolated and very segregated, think certain employment types of, sheltered workshops, that kind of thing, that if it's not HCBS compliant, you can't buy it, okay, in self-determination. Next year in 2023, even traditional services have to show that they are HCBS compliant, which is a multiple step process. So we're not going to go into that today, but just be clear, whatever you buy with self-determination, the feds have to recognize that, yes, this is a service that helps you live life your way in the community. The provider has to be qualified, and then they have to be HCBS compliant, or final rule compliant, meaning it has to give you opportunities to be in your community or to live your life your way. Let's see. Oh, I'm sorry. Laura clarifies for me. She moved out of California. They're now in Idaho, no regional center. Can this work for me? So Laura, you want to reach out to the Idaho State Council on Developmental Disability. So the my agency equivalent in Idaho, because there's one in every state and US territory. Laura, if you reach out to your Idaho State Council on Developmental Disabilities, they can help you. They can tell you if Idaho has a self-determination program. They can help get you connected and let you know what the system is there. And sorry, I misread your initial comment in the Q&A. Let's see. Elias says, what if we've not been spending through the regional center because they don't have the services we need? Exactly, exactly. So if you haven't been able to get a lot of services through the regional center because they didn't have what you needed, remember going back to that calculation. And sorry, I'm a few minutes late, so we probably already covered this for you. It's okay, because they think of, if we had the services, what would we have spent? That's your baseline when you go through that budget exercise, multiple step budget exercise, okay? Let's see, Kelly says, since last year was not good representation of services with COVID, so true. Will they look at budgets of other years? So they will not, but remember, Kelly, what they'll look at is they'll also look at unmet need. So not just what was spent last year, but for example, if you needed respite but didn't get it, then that's gonna be part of your calculation for your budget. Same thing with ILS. If you didn't use ILS or minimally used it because COVID and a variety of other reasons, it's okay. That goes into the calculation when determining your budget, so it's all right. Tuition for college programs. So Chuck, you'd have to, what they would want to see is, have you looked at generic services to spend that, to purchase? So first, I do know that some people have purchased certain types of tools and supports to help somebody in college. I don't, but it would have to be, what services generically can you use already? So certainly, what services are available through the DSPS services with the university or with the college. Tuition in most cases is not going to be reimbursable, but supports and services may be. Let's see here. Sarah's asking, regarding spending, the assumption is we don't know how much services and goods cost to make the plan successful. If you don't know the prices, we would talk to vendors. Their prices may vary widely. Yes, that is correct. So your budget, the number that you're starting with, is based on what could have been spent for a similar service. Your regional center can talk about the rough rates for certain types of services. Otherwise, you're also kind of thinking about, what does the market bear in your area? So if I'm negotiating an ILS-like service, maybe not exactly, but something like that, that rate might be much different in San Francisco than it is in Bakersfield, right? So so you're saying there could be many updates to the budget every year. No, there wouldn't be a substantial amount, because you're going to do that work when the budget's being created. Then you have that money, and remember, then you have more flexibility in developing the spending plan. And then Kathleen says, is my budget IPP driven? Yes. So that's why I've talked a lot about both today and other times, the importance of, do the person-centered planning so that IPP is really reflective of you or your loved one, because that's going to matter. So in doing the budget certification work with your regional center, they're looking at your IPP and looking at what was spent this last year. The IPP may have some unmet needs that never were addressed with what got spent last year. So there you go. Instantly, you can see your budget's going to be higher, because the IPP is going to call out, hey, here's for the things we needed, but that we didn't actually get. Okay, I was trying to cover a good chunk of that. Where are we on time? Oh gosh, we're almost done today. Okay, let's see here. You know what I'm going to do? So Marianne probably already sent you the deck, or will be sending you the deck and a couple of handouts. I'm going to send her some additional handouts, including spending categories, service definitions. So that way you guys have that in addition to what we're talking about today, since we can't be here all day together. Let's see, what else do we want to cover in our short time? Here's another example here when we talk about generic services. So if you are eligible for HSS, you got to use those dollars first. Then you can use additional self-determination dollars. If you have a service that the district should be funding, you got to have the district fund it first. And then if there's additional needs, your self-determination dollars can help. If there's something you need, like a therapy, and Medi-Cal or health insurance should be paying for that, they have to pay for it first. Then if you want additional or more services on top of that, that's where self-determination can come in. So it can help you save money. You save money in your spending plan for the things that matter, because part of the process is making sure that the funding sources that should be paying for things already are paying for them, okay? So this slide talks a little bit more about generic resources there. This talks a little bit about the final rule, HCBS, home and community-based services. So basically the little assessment, if you go to hire a person or a service and your FMS and your regional center say, oh, this is different, and different's good in self-determination. But what if it's a more segregated, isolated type of service that doesn't give you opportunities to be included in your broader neighborhood or community? Then they may have that provider or that professional you're hired go through an assessment to make sure that what they're providing you is home and community-based compliant, okay? And there are some great HCBS handouts. If you want more information on that, let me know, email me. You know what I'm gonna do here? Let's see, I'm trying to find the chat. Let me pull up the chat for a second. Okay, you can email us if you want more information on home and community-based settings. Oh, that was only panelists. My apologies, guys. Hang on. Let me make sure that my email goes to all of you. Okay, so just reach out and I can give you more information on HCBS. But for the purpose of today, we just, you know, and for most of what you're purchasing, I don't think it's even going to come up. Okay, so it's going to be more rare of a situation. But this is the settings process. So if you do want to bring something on where your FMS and your regional center is saying, we're not sure if that's home and community-based compliance, this is a little bit about that process. But this is going to be minimal. Most of the stuff that you're purchasing or services that you're purchasing or agencies you're engaging, you won't have to do this assessment, okay? This is only for things that might not be compliant, and everybody needs to make sure they're compliant first. Okay, so I want to sell before we wrap up here today. Local support matters. You want to sign up on your local regional center's interest list, okay? So almost every regional center has like an emailed interest list or a place you sign up on the website. Get on their self-determination interest list. That doesn't mean you're signed up. It just says you want to learn more. Let your service coordinator know that you're interested, okay? And then attend some of the local self-determination advisory committees. They're open to the public. You get to meet people that are in the program. You get to meet independent facilitators. You might get to meet financial management services, and you meet the people in your regional center that are doing most of the work to implement self-determination. So that's a great way to get involved. And then you'll meet other families and people served that are part of that process. So those are some great next steps for you if you're interested in learning more about self-determination. Let's see, can we use the money for attorney's fees to get school services needs met? No. So, you know, if you have unmet needs with your school district, you want to rely on the due process and your rights, your parental safeguards and those rights processes through the school district, okay? And if you want to make sure that you know what those are or want to read some of your procedural safeguards, those kinds of things, let me know. But yeah, if you're battling with your school district and need some rights information about your school district, that's separate from this. But we're happy to help make sure that you have information about your rights if you're having some issues with your school district. Okay. And let me see with our last little bit of time, other questions. Okay. Regarding tutoring, is the school district supposed to be responsible for that? So it would depend on what's in the IEP. Okay, so remember, if it's represented in the IEP, and it's a part of something the district should be doing, then it's paid for, if it's in the IEP. If it's not in the IEP and you're just thinking we want some additional tutoring outside of what the school district, outside of the services that the school district is responsible for, then yes, tutoring with some self-determination dollars could be very helpful. But remember, it's about, is it something that should be in the IPP, yes or no? I'm sorry, is it something that should be in the IEP with your school district services? Is that part of special education rights, the specific service you're asking for, yes or no? Anything on top or outside of that, yes, self-determination might be a great way to fund some additional supports, okay? So again, it's having to say, is this something that another system should pay for first? Okay, and also guys, stay tuned. Oh, we're a few minutes over. Thank you for staying with me here. In the May revise, the California State Budget revise, California is proposing, the governor's May revise is proposing that self-determination get some additional funding to fund transition support services, improved orientations and training, all to help make things a bit smoother with the transition from traditional services. So stay tuned. Next week, actually, we should hear more about that. And in the meantime, here's the contact information. And today I will send some of those additional handouts and listing of services, the subcodes. I'll send that in some of the directives to Marianne to be able to get to you. Okay, so I know we covered a lot of things, but hopefully this gives you a good understanding of what the program's about, enough for you to say, do I want to get involved or not get involved? Do I want to come to a meeting? Do I want to go to an orientation? So there's a lot more left to do. All right.
Exactly. And just one last little add. I think I will go ahead and send in. I loved the idea of going to the self-determination advisory committee meeting. So I will send a link to that, to the different dates on that, because I think that is a great way to learn some more information. So, and just really quick, one last little question. The budget monies are not taxed. Is that correct?
Yeah, so the budget monies are through your existing, it's through the regional center system. Yeah, so that's not money that's going into your bank account that's taxed or anything. This is all, in your regional center kind of special budget with FMS. So if you bring on people, if you're hiring people, you have to follow labor laws, you have to look at liabilities and, independent contractor withholding certain taxes, that all of that in terms of if you're using that money to hire somebody, those things, that's where the FMS helps you. But otherwise, just the money itself sitting there in your account, no, because it's with the regional center. So it looks the same way it does now for you using traditional regional center services. So there's no additional, taxes on that. But you have to look at insurance and other liabilities associated if you use some of that dollars to hire somebody directly, if that makes sense. And your FMS can talk to you a lot more about that.
Perfect. Thank you, Sheraden, so much. You've spent many Saturdays with us this year, and we really appreciate all your time.
My pleasure. And I'll send out some additional handouts, and feel free to go through it, and feel free to reach out to us if you have more questions. And we hope to see some of you, if I assume a majority of you are in the Bay Area. So then we'll see you at some of those local committee meetings. We'd love to have you, just so that you can see the sausage getting made, so to speak.
Absolutely. Thank you, everyone. Have a wonderful rest of the weekend. Bye.